Here is a sample video showing how to accurately read an electrocardiogram. Watch this and then you can visit Executive Electrocardiogram Education at ECGEDU.com to sign up and learn how to read ECGs expertly like this one. The scale is normal based on the grid here. 5 small boxes wide and 10 millimeters tall, corresponding to 25 millimeters per second and 10 millimeters per millivolt. Rate. 300 divided by 2.4 large boxes is 125 beats per minute. Rhythm. There are P waves followed by QRS complexes in all of the beats. The P waves are upright in leads 1, 2, and AVF, and inverted in lead AVR, suggesting a sinus rhythm. Since the rate is over 100 beats per minute, and the rhythm originates from the sinus node, this is a sinus tachycardia. Sinus tachycardia at 125 beats per minute can now be written in the ECG interpretation section. Axes. The P waves are isoelectric in AVL and upright in lead 2, suggesting that the P wave axis is positive 60 degrees. As this is between 0 and 90 degrees, the P wave axis is normal. The QRS complexes are isoelectric in lead 1 and upright in lead AVF, suggesting a QRS axis of positive 90 degrees. As this is between negative 30 and positive 90 degrees, the QRS axis is normal. As there is no adequate isoelectric T wave complex, we will use the graph method to figure out the T wave axis. The T wave is upright approximately 1 millimeter in lead 1, suggesting that it is going toward lead 1 approximately this amount. The T wave is upright 0.5 millimeters in lead AVF, suggesting that the T wave vector is going toward lead AVF approximately this amount. If we extrapolate, we find that the T wave axis is approximately positive 30 degrees. As this is between 0 and positive 90 degrees, this is normal. Intervals. The PR interval is approximately 3 small boxes long, or 0.12 seconds. This is normal. The QRS interval is 2 small boxes, or 0.08 seconds, which is normal. The QT interval is 8 small boxes. 8 small boxes times 0.4 seconds is 0.32 seconds. The RR interval is 13 small boxes, which is 0.52 seconds. The square root of 0.52 is 0.72. The corrected QT interval, therefore, is 0.32 seconds divided by 0.72, which is 0.44 seconds. As this is between 0.36 and 0.45 seconds, the corrected QT interval is normal. Wave morphologies. P waves. The P waves in lead V1 are more than 1 small box deep and more than 1 small box wide. This suggests left atrial abnormality. The P waves in lead 2 are more than 2.5 small boxes tall, more than 2 small boxes wide, and peaked. This suggests right atrial abnormality. Putting this together, there is biatrial abnormality. This can now be written in the ECG interpretation section. Q waves. No significant Q waves are present. QRS complexes. Let's ask and answer the 6 questions. Are they tall, suggesting left ventricular hypertrophy? No. Are they small, suggesting low voltage? No. Are they wide, suggesting a bundle branch block? No. Are the R waves in lead V3 less than 3 millimeters, suggesting poor R wave progression? No. Are there tall R waves in lead V1, suggesting posterior myocardial infarction or right ventricular hypertrophy? No. Is the transition point in lead V3 or V4? Yes. It is in lead V3, which is normal transition. ST segments. The ST segments are depressed in leads 2, 3, and AVF, as well as leads V3 through V6. This suggests inferolateral subendocardial injury. T waves. The T waves are all upright and normal. Throughout this electrocardiogram, we have had no other information that we needed to put in the Think About section. The final ECG diagnosis will be sinus tachycardia at 125 beats per minute, biatrial abnormality, and inferolateral subendocardial injury. Clinical diagnosis. No specific clinical diagnosis is suggested by this electrocardiogram. However, you should consider a restrictive cardiomyopathy, valvular heart disease, or a shunt. Would you like to be able to read ECGs like this? Well, it is possible and in fact easy if you follow the steps outlined in Executive Electrocardiogram Education, the best online video course for learning to interpret electrocardiograms. Just go to ecgedu.com, sign up, and you are on your way to ECG mastery.